MedStar Georgetown Transplant Institute is one of the largest liver transplant centers in the nation with more than 100 transplants per year. They also transplant patients faster than any other center in our region. And joining us to talk much more about this life-saving work is Dr. Tom Faust. Welcome aboard, Doctor. Thanks for being here.
Good morning. Glad to be here.
It's a very important topic. So many people need this life-saving work, a liver transplant. And MedStar, both at Georgetown and with your evaluation center here at Franklin Square in Baltimore, really doing a lot of this life-saving work. Can you talk more about it?
Yes, historically transplants were done, excuse me, at Georgetown, but for the past 2 years, well, actually February of 2017, we began to evaluate patients for transplant at Franklin Square through the use of telemedicine. So it made it easier for patients to be evaluated more quickly rather than having to go down to Georgetown in Washington. So we can get patients evaluated more quickly, listed more quickly, and then be transplanted more efficiently.
It's fantastic news for people in the greater Baltimore region. They're able to do some of this work more locally and still go to Georgetown for the procedure. We also understand when it comes to these procedures, you're achieving some remarkable survival rates.
Yes, our current 1-year survival, meaning patient and graft survivals, over 95%. It's among the best in the region. And our 5-year survival is very high as well, well over 80%. That being said, the median time from listing a patient to transplant is about 8 months, when compared to an average waiting time of about 14 months with other centers in the region.
That faster turnaround, that faster receiving of a liver, I mean, that's life-saving for many patients, including, I think you were saying, high acuity patients.
Yes, we in the region we do the highest acuity patients. These can be subdivided into people with acute liver failure, meaning that if they're not transplanted typically within a couple of days, they may not survive. And the most common cause for that is acetaminophen overdose, so we can get these patients evaluated quickly, listed, and transplanted typically within a couple of days.
Speed is really life in this situation, Doctor.
Correct. We're seeing more and more patients with severe liver disease due to cirrhosis. The #1 indication for liver transplant is hepatitis C. Currently, the #2 indication for transplant is non-alcohol-related fatty liver disease. In the setting of people being overweight, have diabetes or high blood pressure, we're seeing more and more of these people coming to transplant. And it's hypothesized that over the next 5 to 10 years that non-alcohol-related fatty liver will be the #1 indication for liver transplant.
It's incredible. Everything's changing. We used to think of alcohol as such a key contributor to this, but there are many other factors at work here.
Correct. So we evaluate patients for for all the different types of liver diseases. So typically patients will present with problems. They can have fluid retention, ascites or fluid retention in the abdomen, edema, they can have confusion, they can have gastrointestinal bleeding. All of these are indications to be evaluated quickly for a transplant. I think by being up here in the Baltimore region, we're making a presence here, and we want to bring world-class hepatology to the Baltimore region through the Georgetown mantra.
Well, we certainly appreciate the life-saving work you and MedStar are doing, both locally here at Franklin Square in Baltimore and what you do in Georgetown, of course, saving all those lives. More information here available for anyone out there who thinks they may have a concern with their liver, medstarfranklin.org. Dr. Faust, thank you so much for coming in, sir.
Thanks so much, and appreciate all of your good work. And I want to thank everybody at Georgetown. And it's not a one-man show; it's a multidisciplinary effort. And without the excellent work on the behalf of other physicians, the ancillary personnel, and the administration, I don't think we'd be where we are now.
All right. Well, thank you so much for you and your team's work, Doctor.
Appreciate
We'll be back with more Midday Maryland right after this. Stay tuned.